The Mazira Foundation is a legacy in honor of my late dad, Mazira Odwaro, a clergy who had the vision to build a health facility in his village, Vihiga, to change the narrative. Yeah, to change the narrative of preventable deaths. Unfortunately, he died in 1998, having battled cancer for a couple of years. And my many hospital visits, both in Kenya and in Canada, inspired me to get into medicine, to be the doctor that I am today, in order to change, an impact on the lives in Vihiga, the same way the doctors tried to save my late father. And thinking about it, he died and left a widow, a very young widow. My mother was barely my age when she became a widow, so it's hard to comprehend how she managed to get through life at such an early age, and especially in a community where the identity of a woman is first of all pegged on the father and then on the husband. So now, having lost their husband, other than grieving the loss of her husband, she was grieving the loss of self, and for some widows also the loss of property. And I watched her go through grief without assistance, because it is kind of shameful, to start asking for help when before that you were financially okay, you did not need people. Now you have to struggle to put food on the table. So you find that she would put on a brave face and a smile, but deep within she was being eaten up, by the role change and the sudden feeling of being left alone, because family and friends also do not know how to relate with a widow at that point. They do not know how to help you, and you're also not speaking up. So everybody is struggling with this new status, and before you know it, people move on so fast. The world moves so fast, and so the widow is left behind, trying to figure life out. And that is what inspires the Mazira Foundation to not leave any widow behind. We focus on the widows because they're the most affected by the challenges that we seek to change and address, starting from grief and loss, and just how all this affects the health of widows and their household. Being raised by a widow, I'm left still traumatized by so many experiences. How people talk about you and how the society starts treating you. And so I empathize with the household of widows. And as we target the widows, we do not just work with the widows, we extend it to their household. And as we do that, we are impacting the whole community, because when a widow is in trouble, when she's going through challenges, she will share it with someone in the village community, and that person will be stressed as well. They'll be affected as well. So when we target the widow, we are not only impacting on the widow and the household, but eventually it goes to the community. And health being a community problem, it is important to look at it in totality, starting, of course, with those who are most affected and extending it to the entire community. So that is about the Mazira Foundation. The Mazira Memorial Hospital stemmed out of the outreaches that Mazira Foundation has been doing for over 17 years now. And it was because of the need to follow up, particularly on the widows that we were focusing on, because unlike the medical outreach, which gives us an opportunity to interact and see these widows once in a year, we needed something that was more regular, sustainable, yes, and enabling us to actually see these widows more often than just once in a year. And we've had great impact. 300 widows are receiving free medical services at our facility. And this includes endoscopy, which is a service that is not easily accessible. So to see that widows who are not insured and they are not able to afford this service can actually receive it, it is encouraging for us. And we see people from 5 different counties that neighbor Vihiga, that is Kisumu, Kakamega, Nandi, and Siaya. And with more resources, we'll be able to reach out to the widows from those counties as well, absorbing them into our program for the widows. And the most difficult part of my work as a change agent is how to craft your story, how to tell it in a manner that people will be able to be inspired and carry the vision with them, to join us, that is, in what we are doing. But the one thing that has been encouraging and a driving force in what I do is anytime we've had a call to action or a call for volunteers, I have seen my friends, my relatives, my family at the forefront and cheering me on and being part of what we're doing. And interestingly, also seeing strangers, and particularly people we meet just through social media, and they get sucked into what you're doing and become your champion of what we are doing. So that's really inspiring. And it makes me believe that everybody desires to be a change that we all want to see in our communities. And all it takes is being given an opportunity to do that. And I'm ever so grateful to be the person that creates an opportunity for others to also experience the joy of impacting on lives. And we are not stopping. My team always says we are not stopping at this until our voices are amplified and they're loud enough to inspire policy change, particularly for the health of widows. I live in the village, I work in the village, and I love the village, despite the many challenges that there are in being a doctor in the village. I would love to see health, quality health being accessible to the people who need it the most. And those people are not in the rural setup. They're not in the urban setup. They are in the rural setup. And why is that? Because most of the especially specialist doctors are in urban setups. So the rural population is left with barely enough specialists to take care of them.
I understand there are 2 categories of services. There are services for widow, which is free, and there are services that is discounted prices. Can you give a little about the 2 services you provide? One to the widow is completely free, and then I read somewhere that there are some that you do as a highly discounted prices. What informed that?
Yeah, so now health is expensive. Health cannot be cheap, especially if we are not to compromise on the quality. So we would love that we can offer these free services to all widows. However, because of the cost implication, we are only able to take care of a category of women, of widows, as we grow. So at the moment, we have 300 widows that we are able to take care of. And that informs the reason why we have the services free for them. However, like I said, health is a community problem. So we have price policy that ensures the uninsured are actually able to access these services too. So we can't say we are a commercial hospital. Over the years, we've been working as a foundation so that we can be fundable. Organizations will not fund ideas. They fund something that is working. And so that has been the foundation that we've been developing. Where we are at now, we are able to apply for grants. We are actually in the process of applying for those grants. And, having an opportunity to talk about what we do, for instance, on your platform right now, makes it even easier for us to be visible, for our work to be visible. So we are at a point where we are looking at getting the funds so that now we are able to implement the projects that we have been doing, but now in a better way. For instance, we are now enrolling widows into our Health in 360 Degrees. This is something that we have been doing, but now we are giving it a structure.